Hey there, good morning. I'm so glad you were able to come back to the Intergenerational Trauma Therapist Show, where today we're going to be talking about developing an expertise in intergenerational trauma therapy. This is part of our 2024 Immersion calendar on intergenerational trauma therapy to help build kind of that foundation to know if you need or want to specialize further in treating intergenerational trauma. So this month, February, is all about the pathway to specialization and how that works and how that looks and the skills you need and the things that you need to think about when you're treating people impacted by intergenerational trauma. So before I get started in the content, I have a little self-disclosure here. I had an interview with another therapist last week at my office, and I had to bring a microphone there. The microphone I brought, I've been using the same stand as the one I'm using in my office. And guess what I forgot at my office last week? So now I have it rigged where my microphone is actually in a glass. So I'm hoping I don't topple the whole thing over and that we get through this very well today. If I do, I will just put it back together and we'll start again. Okay, so when we look at developing an expertise in intergenerational trauma therapy, you really need to identify your current expertise and areas for specialization that you maybe don't have, or ones that you have really great strengths in. So we want to look at having precision in our interventions and how we select those. We want to have a lot of resources for clients. We want to be able to streamline assessment and develop really targeted treatment plans. And we want to look at record keeping and modification of those treatment plans too. I'm not going to go into record keeping on this live stream because that's kind of it. All depends on what your discipline is, if you bill insurance, what's expected. So we already have our standards for that, but the catch in that is that if you're dealing with the whole family, how do you have to keep their records separate, but then there's also information that has to be in both, like if you do, or all of them, if you do a family session. So we do need to keep that pretty, of course, tight for our ethics and our records, but we need to also keep that in mind when we're working within a family system. So let's look at identifying your current expertise and areas for specialization. So really what we want to look at is both assessment and treatment planning, because those are the areas that we really need to have clear in order to give highly specialized therapy to families who've been impacted by intergenerational trauma. So we have to have knowledge and skills in multiple areas because we're dealing with a really complex clinical presentation. So we have to have skills in working with the adult's complex trauma that's unresolved and impacts the transmission of intergenerational trauma to the new generation. We have to be aware of developmental trauma in children and teens, because this isn't a one incident trauma that will lead to hypervigilance, intrusions, avoidance, changes in thoughts and mood. This is more developmental, where it impacts multiple domains of a child's life and it gets kind of woven into their life and may be mistaken for a behavioral problem or for ADHD or things like that. So it's really important to have that specialized knowledge of developmental trauma and the developmental impacts. So therefore, we need to know developmental psychology as well in order to support knowing how the trauma has impacted the child. We also have to know about attachment because, again, the attachment, the parent-child relationship is really the one thing that we can significantly influence in a family to create a situation of healing. And then because it impacts the entire family, we have to have knowledge and skills within family therapy. So we need to know how to work in the context of a family, and not just doing individual therapy with one person and not considering the impact of of interventions on the entire family. So the interventions that we may need to specialize, and some of these are the ones that I have found so useful, and they really address the impacts of intergenerational trauma, particularly on attachment, are polyvagal interventions. So the degree of reactivity for people impacted by intergenerational trauma can be quite significant because if they've grown up in a family that had some trauma, it was passed down to the parent that you're working with now, they're not going to have the experiences of co-regulation and being able to self-regulate when after they've had those periods of co-regulation. So polyvagal interventions is really the foundation of everything in working with intergenerational trauma, and the relational neuroscience, because we want to work within the natural development and integration of relationships, attachment, and brain development. So it's really important to understand those two specialty areas, and they so interlink that I don't think for this you could have one without the other. We also want to know trauma intervention. So this may be EMDR, brain spotting, accelerated therapy resolution. I'm not trained in that one. But we want to have that in order to process difficult trauma memories and kind of take those neural networks and kind of integrate those into the rest of the memory networks in that, so that they're no longer bothersome with triggers and in the reactivity. So knowing those trauma interventions are also very important. We have to know attachment interventions. So where are your skills at providing interventions for parent-child or teen relationships that support the attachment? So there's TheraPlay, there's all kinds of different attachment interventions that you also need to have those skills. And then we need to have some family therapy interventions because we're working within that family system. And our main goal in intergenerational trauma therapy is to stop the transmission of intergenerational trauma through the parent-child relationship. So we have to have all those areas. So that's what makes it extremely complicated, and where the specialization is actually very narrow and at the same time very broad because of all the areas that you need to be specialized in. So I would just ask you to kind of look at your self-development, your professional development, where you're at with all those areas, and what are some areas that you need to develop some skills in order to support the specialty of treating intergenerational trauma. So the next area we're going to look at is precision in intervention selection. So because we have, oops, I did it. I didn't think I would, but I knocked my microphone. Sorry about that. So we want to have the ability to precisely determine where we're going to intervene, because again, we're dealing with all these complex issues that if the child's behavior is way out of control, very risky, very dangerous, difficult in all environments, that may be where we want to start, because we're going to, if we can get some of that behavior to shift or change, then it makes everything else easier. In other cases, we may want to start with the parent and giving the parent just some really solid parenting skills and strategies and understanding attachment and developing safety in the parent-child relationship. So there's multiple areas that we can start. And the importance of being very targeted in our interventions and very precise in where we start and where we continue to focus is really because a lot of these families are very overwhelmed. They've been dealing with these difficulties for generations. So this isn't just like a year ago something happened in one of the family members' lives and it's thrown everything off. This is generations deep. So they may have a lot of overwhelm and they may feel very hopeless. So if we can get them quick wins, make progress quickly, it gives them some hope, and it gives them the ability to engage further, and gives them kind of the confidence to move forward and all that self-efficacy that's so important in therapy. The other reason we want very precise interventions is we're dealing with multiple layers and it's generational. So we may have grandparents, parents, children, may have extended family members that are also impacted because of the intergenerational nature of this type of therapy. So what we have to be careful of is we can help one generation and hurt the other generation. And that's not going to be effective for overall intergenerational trauma therapy. So I've seen this before when a person goes into therapy and the therapist isn't trained in any kind of family therapy or the importance of the context of the client. They encourage them to set really firm boundaries and really kind of go hard. And then the person does that, and it makes everything worse because they didn't account for what is the family system like, and how is the family going to react to that? Will they react well to really firm boundaries, or will that put this person at more risk? And there are some families that when you set boundaries, it will put the person at more risk. So we've always, because this is intergenerational trauma therapy, we've always got to consider that. But I think we always need to consider the other family members when we're even doing individual therapy, that's part of contextual family therapy, which has been so useful for me in working with intergenerational trauma and even individuals. So because there's so much complexity between the wide range of impacts, the different layers with generations and impacts, imprecise interventions can make therapy much longer, and it can make it much less effective. So if we have people who have very little hope that anything's going to change and they've never known anything different, we want them to get those strategies and interventions very precisely so that they experience a shift and they get some hope and some positive thoughts about therapy and engaging and see the value in it. And if we don't have those precise interventions because we're dealing with the complexity, we can sometimes cause harm in some cases. So that's like the example of pushing like an individual goals and things for one individual in the family without kind of recognizing the context of what they're living in. And sometimes that can do harm, which we do not want to do ever, but especially for people impacted by intergenerational trauma. So now we're going to look at resources for clients. And it's so helpful to have a variety of different types of resources, different levels of reading, different ways of implementing, from podcasts to reading, books, handouts. All those things are really important to support learning in between sessions and to kind of review skills and have that for when they're not right with the therapist, and it helps reinforce the learning. So not all clients will need or want resources. Some clients love to read in between. I've had some teenagers that like they bring in their little folder and they have all their worksheets and they want new worksheets on what we're talking about. And they're just very structured that way, probably because they're in school. But some people are really heavy on wanting those resources and some people aren't. Sometimes with intergenerational trauma, their lives may be so chaotic that organizing a bunch of paper is not going to be their first priority. So we have to respect that and kind of meet them where they're at and try to give them the skills anyway. One of the primary benefits of having handouts and resources for clients is for their learning. But there's also another benefit that may be a little less understood. And that is when you're dealing with highly traumatized people where you've had generations of trauma and there's not a lot of coping skills, there's a lot of reactivity. One of the things that can happen in therapy, if you're not careful, is they can end up flooding. So all those thoughts, images, memories, the emotions, the autonomic dysregulation just kind of floods, and then you can't make progress. It can happen in therapy naturally, but we also want to kind of keep it where we're kind of titrating and pendulating between how deep are we going and how can we visit the dysregulation, and then can we pull out of it and get to a more regulated state. So resources are really helpful for this because when you're using resources, they take higher cortical activity. So they have to think about them. They have to read the language on the documents. They have to look at the pictures. So it actually can help inhibit that flooding because it's a higher cortical process that kind of helps that integration and that balance between those two areas, like the lower brain structures of memory, emotion, sensation, and the higher cortical processes of language, talking, reasoning, all of that. So that's why I love resources in therapy. So my go-to list of resources are, of course, in my own program, I use these. The Intergenerational Trauma Toolkit has a 27-page workbook for parents. The Intergenerational Trauma Program, so that's the larger program, has 5 workbooks. There's a parent coaching workbook that has 60 pages. There's a complex trauma workbook for the adults that's about 76. There's a child trauma workbook, which is about 56 pages, and a teen trauma workbook that's about 73 pages. And then there's a family resilience and parent kind of review of the coaching that has 64 pages. So these are the materials and the resources that the clients get when they enter into this program, or if they're not formally in that program, the skills and the worksheets are made so that they can be pulled and used one by one. So that's a whopping total of 325 pieces of paper and worksheets that you can use with clients through that program. So some other resources that I love are Janina's Fisher, Transforming the Living Legacy of Trauma. I think she's got a flip chart and a book. There's Dan Siegel, The Parenting from the Inside Out, No Drama Discipline. All of their parenting books are really good. I think they're Dan Siegel and Tina Payne Bryson. Another really good resource that I have found parents really like is the A to Z of Therapeutic Parenting by Sarah Nash. It is kind of a dictionary of different things. So like biting or tantrums or stealing, it'll explain why that's happening and strategies to deal with it. But it's also extremely trauma and adoption informed. So it's just a really good resource for parents. And then Deb Dana's Polyvagal Exercises for Safety and Connection. I think she has a flip chart as well, but I think it's for a different book. And then Robin Gobel just released Raising Kids with Big Baffling Behaviors. That one's also really good for parents to understand the behavior and take a more trauma and attachment informed approach, and kind of shies away from the behavioral interventions, which can trigger even more reactivity in kids with trauma and attachment disruptions. So how do we streamline the assessment process? That's the next area that we're going to talk about. Assessment of individual concerns is useful. So looking at a trauma scale for a parent, or anxiety, depression, same thing for kids and teens, getting their individual scores on those assessments can be really important because it's like a baseline. It can help you with progress. The problem is individual assessments don't consider the family impacts and the relational impacts. And those are the main impacts that we see with intergenerational trauma. So that is the main concern. And if we're not assessing that, we're not going to get the information we need. We're going to make decisions in therapy that aren't going to be the most efficient or effective. So we really need to have a way to assess all those family impacts as well. That's why I developed the 5 domains checklist, because it's specifically related to intergenerational trauma and what you will see in the therapy room, the therapy process, and the relationship between parent and child. So assessment of the parent-child relationship and attachment is really good, and it will be really helpful. But there's some things that are very specific to intergenerational trauma that those attachment assessments aren't going to specifically pick up. And these are areas that can really derail therapy quite quickly if we're not aware of them and able to intervene. So the first area is there's difficulties engaging in therapy. Maybe the parent doesn't want to be involved in sessions or doesn't want to have um, like sessions with the therapist to learn parenting skills. They have other people drop the child off. They don't want to talk over the phone, or there's just a barrier there for engaging in the therapy. And then you'll also see difficulties with co-regulation between parent and child, and it can be on either side. So it may be that the child is really good at dysregulating the parent, but the parent's very prone to being dysregulated because of their own unresolved trauma. And we really need to look at that very closely, because that's one of the main transmitters of intergenerational trauma, is those difficulties co-regulating in that relationship. Parenting strategies that backfire. A lot of people who've come from histories of intergenerational trauma have experienced harsh or coercive parenting that it's what they grew up with. So they think that's what parenting is, but it actually perpetuates that cycle of transmission and creates more impact. So we want to really look if they're using a lot of strategies that backfire, and we have to get them strategies that are less likely to backfire, and they will help build the attachment in the relationship. Also want to look at, how does the parent view the child's behavior? Do they think it's willful, intentional? Do they have negative kind of mentalization or interpretation or understanding of the child's behavior? Because that's going to be really important when we're doing interventions and supporting the parent. If they have a really negative mentalization and picture and understanding of the child, we're going to have to address that in order to use different parenting strategies and have more compassion for the child and more commitment to their healing. We also want to look at the child's negative self-beliefs, because these start to develop really they develop very early, but the prime time for developing these is between ages 5 and 7, where the brain can put patterns together, but it can't fact check. And it's also very self-referential. So everything that happens, they believe it's related to themselves, or they caused it, or it's because they've done something. So we really want to look at, does the child have beliefs that they're a bad kid, they're unlovable, the world is a terrible place? Like, what are those self-beliefs that the child has from growing up in the context of intergenerational trauma? So those domains get to the heart of intergenerational trauma, the impacts on the parent-child relationship, which is the most important aspect to stop that transmission. I also use an in-depth referral form when we have a referral from like a child welfare protection agency. It has a lot of the information that's really helpful in kind of putting a larger picture together of the family system, their history, and the context under which they're currently living in as well. I use a comprehensive intake assessment where we look at a lot of areas. We look at current stressors, how difficult is the community that they're living in? Is there a lot of danger there? How are their relationships with other people? How do they utilize community resources? So we want to look at all of those to find not only the areas that we need to address for intervention, but also their strengths, because the people who make it through this, there may be dysfunction in one side, usually within the parent-child relationship, lots of reactivity, but they're survivors and they've got other resources and strengths that we really want to highlight. And you can use those individual trauma assessments to monitor progress of each family member or the family member that you're working with. So now we're going to look at creating targeted and effective treatment plans. So treatment plans can be tricky because with intergenerational trauma, you're going to have both individual and family goals. And a lot of times we're taught that we can only work with one person in a family system and someone else should be working with the other people in the family system. And that's very true in some cases, and even in some intergenerational trauma cases, that is true. But the intergenerational trauma program is an intervention where really the family is the client rather than one individual, but you have to address all these individuals in order to have the family impacts and outcomes. So you want both individual and family goals. So the 5-domain checklist will help identify those most problematic areas that are required to address in order to decrease the impacts. So in some cases, you may want to start with parent coaching. So this might be a case where the child may be in foster care or living with another relative. And the parent coaching will help build the parent skills. It will help give them a foundation for when they have visits or reconcile with the child or reunite with the child. You may want to, if the parent's unresolved complex trauma is really impactful in the family system and on the parent, you may want to start there. If the child or teen's trauma is really impactful and causing a lot of difficulties for the child and the family system, you may want to start there. We have some referral sources that require the child, the payment is for the child and the resources is for the child. We can do work with the parents, but that's one that we would probably start the parent coaching and the child's trauma therapy at the same time, unless there was a contraindication that would say that if we don't get the parent the skills that they need first and we start addressing the trauma, if the child goes through a period of getting worse before they get better, which can happen, the parent may not have the skills to handle it. So there's all these big things to consider and think about when you're working within a family system impacted by intergenerational trauma. So the treatment approach needs to be individualized for each family and each family member that is going to be involved in therapy. Treatment's flexible to adapt to their specific needs, but it's also structured at the same time, which we'll talk about next. So really, we want to be able to identify those goals that will support the individuals in the family and the overall family. And in that, we also want to include, like, what if we're working with just a parent, did it again. If we're working with just a parent and the child, we don't want to not consider the impact on the grandparents. Like, we may not have permission to work with them, but we may want to kind of consider, like, how will the intervention affect their relationship with that generation, and how can we strengthen that? So it's a very complicated web of treatment goals that we can end up needing to develop in order to address the needs that these families have. So now we also have to have some flexibility in our treatment planning and as we go along, but we don't want to have so much flexibility that we're always dealing with crises and we're never getting to some of the substance that we need to get to in order to improve the family's relationships, the attachment, and decrease the reactivity. So we have to be flexible and adapt treatment plans, but we also want to have some structure and like a decision tree of why and how we do that. So some families are in crisis all the time and life is just chaos for them. And sometimes we have to attend to that chaos and crises, especially if it's a new trauma or a new something that just happened that just is significantly impactful to the family. But we also don't want to get caught up only dealing with crises and never getting to the roots of what's happening. And sometimes that's where families function, because it's what kind of helps them stay together or helps them get through life and the crises, but they never get down to the substance and the root of the difficulties and make that progress. So we have to always kind of have that in the back of our minds. Um, so due to the complexity of intergenerational trauma, there's so many layers of therapy, and we need to continually observe those layers. So we may have a situation where the parent learns new parenting skills and strategies and attachment, and the child reacts out of fear, or their attachment system is engaged and the strategies they used kind of push back against that. We have to be able to kind of work through those difficulties while supporting both the parent and the child. So we always have to look for those layers. We may also need to look at the layers between generations. Even if like grandparents aren't involved in therapy, we have to consider how this is, how what we're doing in therapy may impact them as well. And we have to make sure it's healthy, first of all, for the family that we're working with, but we also don't want to alienate them from any good protective resources that they may have in their environment. So therapy goals will remain the same in the broad sense, but interventions and timelines may need to be pretty flexible. Sometimes the people that I work with are living in environments that they're not safe. There's a lot of violence that you can't say, okay, let's put the robbery you experienced last night to the side and work on your parenting skills. It might be dealing with that robbery right then and there and giving them the experience of co-regulation and attunement and responsiveness so that they have that experience. So it's not just, oh my gosh, we lost a session because a robbery happened. You've provided that client or that parent with a new experience of how to get through that in the context of a relationship. And that is likely something that they probably haven't gotten in their family of origin. So it's still very important, but it can sometimes feel like we're not addressing our goals, especially if you're highly structured and very goal-oriented. So there, like I said, there will be both individual and family goals. The family goals may come in later and in more complicated cases, because you really want to have that foundation in the family of good attachment, good co-regulation, and the safety in the relationship, that you don't want to look at the family goals until you've got those things, that foundation built, because you need that regulation and attachment to be able to do some of the family goals. But we also don't want to lose sight of those family goals and kind of do things that drive the family goals where they're harder to reach or where they become less likely because that we've done an intervention that is more individually based, and it kind of goes against kind of family interactions and family connections. So it's very delicate balance sometimes. So we do also need to monitor for crises, and be flexible, being aware that this can also be a distraction over time. But some of the clients that we'll be working with when we're doing intergenerational trauma therapy can be living in crisis all the time. So we do need to find some stability for them so that they can work on the treatment goals, but the crises may actually be valid and take priority over the immediate treatment goals in the trauma therapy. Okay, so we have looked at all these areas of identifying your own areas of expertise and where you may want to specialize further. We've talked about being very precise when we select interventions. We've talked about having resources from clients, for clients, streamlining assessment, having targeted treatment plans, and modifying those treatment plans as we need. So this is week 2 of February in the Intergenerational Trauma Therapist Immersion calendar for 2024. And so next week, we will be looking at treatment planning, which is what we've talked about a little bit today. So if you want that 5 domains assessment checklist for therapists, it's at 5domainschecklist.com. The Intergenerational Trauma Therapist Immersion calendar is at calendar.barbarawoodsphd.com, and I'll post those links around this video. So I hope you have a wonderful day, and I will see you next week.